Zimbabwe had one of the worst HIV epidemics in the world, and at its peak around the late 90s and early 2000s, about 33% of adults actually had HIV, which meant like 1 in every 3 adults was infected with HIV.
We are seeing a significant number of new infections. Estimates are around between 120, some even estimate to more than 200,000 infections per year.
During that time, there was no treatment and a lot of deaths did happen. Some families did lose their mothers, their fathers, their children. Babies were dying very early, and in some instances, entire households were wiped out.
Mama burutsa imatsima ndivabe veneka imore mandione mambo Ide burutsa imatsima ndivabe yeah baba we
I'm the director of an organization called Transmart Trust. I'm a person living with HIV for the past 21 years.
Ndine makore 45 ekuberekwa. Ndakabatwa utachiona mugore ra 1998.
I was born with HIV and I've lived with HIV for 29 years.
I'm 61 years old. I'm the director of Life Empowerment Support Organization. I started this organization in 2008 after having been tested for HIV in 2005.
In 2002, I wasn't feeling well. I had to go for HIV testing and I came out HIV positive.
I'm 59 years old. I'm living with HIV for 23 years.
I'm a person living with HIV. I started initiation on art in 1999.
I'm a person living with HIV, diagnosed in 2005, now 16 years on art.
I've spent 20 years living and working amongst people who have HIV.
I'm a journalist who has close to 2 decades of experience in both electronic and print. The story that really touched me during my course of work is the story of HIV.
I'm an epidemiologist. I have been working in the HIV and TB arena for the past 20 years.
I'm very passionate about educating the young people of HIV and AIDS.
The PEPFAR Heroes program came about after the realization that so much has happened over the last 2 decades and almost 2 decades of PEPFAR funding. There's a lot of investment that have happened.
I would not talk about the HIV program and not talk about PEPFAR. PEPFAR is the United States President's Emergency Fund for AIDS Relief. And this came in handy when it was announced by President George W. Bush in 2003. I think the timing was near perfect, as then we were almost at the peak of the HIV epidemic. And we really needed treatment at that point.
We are really seeing quite a different face of the pandemic now, with a significant number of people who are living with HIV now on treatment, almost about 90% of them. So this means that people who are living with HIV are able to live long and healthy. And what has really helped to turn the tide has been a concerted effort amongst various stakeholders, with particularly the PEPFAR program coming through to support the work of the Ministry of Health and the National AIDS Council around about the year 2006, and also significant support from other donors like the Global Fund.
The investment is also synonymous to the lot of efforts that have also been poured by different people from across the divide, people that make PEPFAR great, people that make the programs that are being implemented sustainable, people that continue to be foot on the ground. We have worked very hard to push the margins to fight HIV pandemic. These are our superheroes. These are people who have also gone beyond the call of duty to advance issues on HIV, to fight against HIV stigma and discrimination, and again, also being a call to action to continue pushing the margins, to do work that helps people living with HIV in their diversity.
I'm a mother of 4, a grandmother of 5, and I have 2 son-in-laws. Why I was chosen, it was how I have helped other people to see that being HIV positive is not, it does not mean that you are dying. Actually, for me, it means saving lives. So I've been trying as much as possible to save lives by encouraging other people to go and get tested early, to get their medication, to take their medication, and also to do counseling when people who are HIV positive are down. I first got involved in support groups when I was not HIV positive. I have 3 of my sisters who died because of full-blown, not HIV, but full-blown AIDS. I think that is where I got this shungu yekuti I have to do something to save other people with information.
Asi mushure mekunge mandaziva status yangu ndakazoita vana vangu 3 vanhu vese vari negative, uyezve ndinonwa mushonga wangu zuva nezuva. Ndiri munhu akada kutsvagurudza zvakanyanya kuti vanhu vangabetsereka sei, sezvo tikatarisa makore iyayo vanhu vazhinji vaifa nekushaya zivo, nekudzidzisawo vamwe vangu kuti vangagone kunorarama sei dai nekunokunda. Semunhu ndinoshanda pachipatara, ndine vanhu vakawanda vandinosangana navo se-facility linkage officer. Ndinoona ndo vazhinji vakabetseredzawo kundisumudzira kuti ndinominetwe kuita PEPFAR Hero. Inini zvekare ndiri mupostori, saka ndine nguva yandaienda mumachechi ndichienda ndichinodzidzisa.
I started Dreams HIV and AIDS Youth Network when I discovered that most of the young people were born HIV positive, and also they had no information about HIV. So at that time, most of the young people didn't want to come up because of stigma. They didn't also understand why they were born HIV positive. So I thought it was better for me, since I was HIV positive, also to assist the young people. I was nominated because I'm the first to have a smart urban farming in Chitungwisa. In 2000, I was the first person to start a support group here in Chitungwisa, which had 200 people. I'm also an HIV activist who stand for the people in the community, those who are living with HIV. I can say I'm the bridge. From the hospital, I get the information and share it in the community, and then from the community to the hospitals. So I'm a well-known person around the issues of HIV.
I'm a married woman. I'm 56 years old. I've got 3 children. Why I think that I've been nominated to be a heroine, helping people on what is happening, and I came out, I've exposed myself that this is who I am, and I'm helping all those who are also living positive to not to default and to adhere to their medication. It is very important for people living with HIV to adhere, just because if you do not adhere to your medication, this is when people say HIV, it kills. It doesn't kill. It is because one would have not adhered to their medication.
I have been working in the HIV environment for close to 20 years. I would mention quite a number of things. The book itself is indicative of that recognition. It helped families. It helped people living with HIV. It encouraged a number of people to come out openly.
I had challenges here and there in terms of accessing treatment, and then I was initiated to ART in 2009, and then 2012 I started working with pediatric adolescent treatment for Africa. I am a peer counsellor at United Bulawayo Hospital. At the same time, the current coordinator of friendly service delivery, an organization that focuses on youth-friendly HIV services and also creating demand among young people for HIV and SRIH services. In my work, I provide peer counseling and also psychosocial support, defaulter tracing and community education, and also empower peer supporters to also be able to stand up for their rights and be able to educate their peers, as well as being involved in decision making, especially on issues that affect young people. The reason why I was nominated, I believe it's because of my track record, the changes that I have come with, especially when it comes to delivering services to adolescent and young people, and also the spaces that I've provided young people with in terms of linkages, and also providing a space for them to dialogue with health service providers, with community leaders.
The story of discrimination to those that has been infected by HIV has been going on for decades. But within that, there is also a community that I would say faces multiple discrimination. Some would want to say the key populations. These are men who have sex with other men and women who have sex with other women, and also sex workers. Their story has remained untold because of various factors, which includes religion and the traditional side. The community has been treated as outcasts, unwanted, and people that should never be associated with any common man. I saw a gap in that and said to myself, why not tell their unique and untold story? The nomination to me came as a surprise, and I would like to say thank you to the person or people that nominated me. This really shows that the stories that we have done have got a digital footprint.
I'm from Zaka, Jerera, Masvingo province. My journey started at St. Joseph High School in 2003, where I formed a club called AIDS Free Generation Club. My main objective was to make sure that the youths and my fellow students are educated about HIV and AIDS. I then continued with my journey to the university level. I attended my tertiary education at Great Zimbabwe University. I joined the peer education club and I was very vibrant. Our main objective was to make sure that all the students at universities could graduate alive, and they will make sure that they will prevent HIV infections. The network that I've created in the society that I was born and in the society, in the communities that I'm working with is very strong. The members whom I'm living with, they know me about HIV and AIDS awareness campaigns. When they saw the adverts about the PEPFAR Heroes 2021, it was easy for them to select me.
I managed to come out openly living with HIV when I had retired from the Ministry of Health and Child Care. That's when I got very much empowered, counseling people. Now I started thinking that I should have my own organization with the oath of saving lives. Some people, they were looking at me being healthy and they were inspired that the nurse, she's also HIV and she can work in the communities. And so many people followed me up at my homestead. I lived in Chitungwiza by then, and I managed to turn my house into offices so that I can cater for the community of Chitungwiza. This is where I started being empowered and advocating for treatment for people living with HIV, advocating for proper access and quality of care for people living with HIV. I was nominated to be a PEPFAR heroine because of my living openly with HIV and also educating people to be not on denial once they are found to be HIV positive, and to shun stigma and discrimination against people living with HIV.
I work with the key populations, prisoners, women, adolescents, and people living with HIV. I have a passion of this work. Being the voice of the voiceless, I was putting the concerns, the needs for people living with HIV in the highest decision-making body, which is the country coordinating mechanism, which is headed by the Global Fund. As somebody who had a passion, I initiated some programs on HBC, which is home-based care, caring for the terminally ill. By then, people were dying in numbers. So we're caring for the sick, the bedridden, taking them to the hospital, getting them treated, and maybe getting them back home. People chose me as a PEPFAR hero mainly or solely because of my hard work in HIV programming. Since I had a passion for this work, it was beyond doubt that people had to really distinguish me, my capacity and my activism in terms of HIV programming.
I am the Director for Space for Marginalized Groups in Diversity in Zimbabwe Trust, working with the key populations, sex workers, LGBTI community, adolescents, girls and young women, youth in school, youth out of school, and youth in tertiary. Also, we're advocating for the rights of the minority who are marginalized. That's the focus of the organization. I worked with people living with HIV since 2006, doing advocacy for them to attend HIV services for free here in Masvingo. And we documented a local level advocacy book for people living with HIV and the challenges that they are facing.
I believe I was nominated to be a PEPFAR hero because of my contribution in the area of data generation. And I feel very excited because I've had an opportunity to contribute to addressing an important public health crisis in our country and in the region as a whole. I'm an epidemiologist. I've been very actively involved in the first ZIMFIA, that is ZIMFIA 2015-2016. I also led the second ZIMFIA, ZIMFIA 2020, and I also led the survey looking at HIV in men who have sex with men. And I also led many other research studies that have assisted the Ministry of Health and others with key information which has been central to improving the national HIV response. I think the greatest achievement for me has been the contribution to the generation of information, evidence, data, which has assisted the Ministry of Health to improve the HIV program, as well as for them to be able to make a case to various donors and funding partners, and for them to be able to continue to get substantial funding in order to address the HIV problem that we have in this country.
The PEPFAR program, the government National AIDS Council program, and eventually the Global Fund came in strongly to support, the HIV treatment programs. And I think those programs did make a lasting difference in really initiating and scaling up access to HIV treatment.
The introduction of ARVs was a game changer. This is what then brought hope to an otherwise hopeless situation.
People living with HIV are now living longer lives, more like even those who are HIV negative, because the medicines that they are taking is also very effective and is ensuring that they remain virally suppressed. And if they are virally suppressed, the chances of them transmitting HIV to the next person are limited.
So what we have seen is a significant reduction in terms of HIV infection from an estimated 120,000 at the peak of the pandemic in 1993-1994. And currently in 2021, there were an estimated 23,000 new infections. And this is a significant drop if you look at those two time periods.
Zimbabwe is one of the few countries that are on track to achieve the UNAIDS 2030 target. And we all know that HIV is an important public health problem. So I don't believe that Zimbabwe will fail. Also with the very strong support that we get from our donors such as PEPFAR, we are very well positioned to meet the 2030 target.
Zimbabwe has done a great job under very difficult circumstances to come this far in the HIV response, and we are nearing epidemic control, which means a situation where we don't have a lot of new infections, and we are also not having a lot of AIDS-related deaths, with people infected with HIV living what would be their normal life and their normal lifespan or life expectancy, so to speak. And my hope really is that we continue to strengthen the programs that we have right now, but also start to shift focus slowly to sustain the gains, continue to prevent infections, focus on prevention, and also make sure that we also focus on sustainability. It is very easy to lose what we have gained if you don't plan adequately to sustain it. So it is my hope that we don't drop the ball, we keep the funding flowing, we keep the programs running, we keep prevention programs, make them stronger and stronger so that we prevent new infections until we achieve epidemic control.
The legacy that I want to leave, it's a legacy where young people are free to talk about their sexuality. Young people are free to even talk about their HIV status on the streets, on the road, where it's not even something that is shameful.
I want to be someone who will see a free HIV youth or a free HIV generation who are healthy and fully empowered.
Being HIV positive is not the end of the road. And being HIV positive does not mean you are on deathbed.
When you are looking at me, you cannot even detect that I'm living with HIV. But what I really understand is to give people lemon to make lemonade, such that they can have vibrant and innovative life.
Being HIV positive doesn't necessarily mean that you are dead or you can't do anything. We have to be resilient. We have to know that this is just a disease. It is just a condition that can be maintained.
We all have the status. You might be positive, you might be negative, but you are all young people. Let's support one another. Because through supporting one another, we can reach a long way and we can achieve positive results.
I would love to leave a legacy of quality of care for people living with HIV.
And I believe that with the new technologies, the new interventions that we have, like PrEP, male circumcision, the number of new infections will continue to decrease to a point where we don't even talk much about HIV infections. That's my prayer and that's my hope. And then maybe I can retire.
COVID is just a number. There are so many people that continue to do great work, and they are also recognized. If you want to see your heroes, you look around your community, and there are so many people who continue to push for people living with HIV to enjoy their rights to the fullest, and we recognize them.